everyone. I'm calling this meeting to order. The next item on the agenda for this evening is the approval of the meeting agenda. I need a motion, please.
I'll make a motion that we approve the meeting agenda as presented.
Okay, I'll second. So we have a motion and a second, and all those in favor of the motion say aye. Aye. All those opposed? The motion carries. Okay, let's go to item number 3, Gravity Diagnostics. Dr. McDonald, I do want to say I appreciate that you sent out a heads up to everybody concerning that. So if you would.
So, so what Gravity Diagnostics, it's one of the laboratories that's on the state school list for testing. And so we, through this contract, are not planning on having them in the school building, but what Gravity Diagnostics has done is they have set up a laboratory in Danville. It's out in the old Farmers Bank building across from Cattleman's. And they set up a drive-through testing site. And so with us going into this contract, what this does is if, and it is completely optional, if any of our staff or students needed to be tested at their own decision and optional for them, they could go out there, get in the drive-through line. They would not have to have an appointment. They could go through the drive-through, have their COVID test, and under this contract, all they have to do on their paperwork is check that they're a Danville school staff member or a Danville school student, and then the billing for that testing will go straight to the state, and it allows the state to use federal COVID relief funds to pay for that testing. They also are going into partnership with 3 other districts. It's my understanding that they already are in contract with 2 others. So we will not receive information on who's tested. That's still the employee's responsibility for notifying us. If they have a positive test, it's still the family members of our students' responsibility to notify us. So we're not exchanging any information. It simply allows them ease of getting tested in a quick manner, and also to have results quickly through Gravity Diagnostics. They drive all of the samples immediately to the lab, and any individual, student, or staff that's tested would receive an email by midnight that same day to know the results. It also is the PCR, the more reliable testing, and it is not a rapid test. So it just opens up options for our staff and students. Any questions?
They're really going to have to call in, do they?
No.
So it's strictly voluntary.
Absolutely.
The district receives not any information.
None at all.
Whether they tested or and what the results are, we don't receive anything.
That's correct.
It also is paid for as long as you identify yourself as a staff person, a student of the Danville schools, then it's totally paid for by the state.
Yes, and that's the reason.
No, it's to the feds.
Well,
Well, if they're using fed
they're
money.
using federal money.
Okay,
It's billed to the state, and then the state will pay for it with federal relief funds. And that's the reason we're going into the contract, to allow this company to bill the state for a K-12 staff member or student. So.
Any questions? Or go ahead.
I also sent the contract to Mr. Pennington, our school attorney and district attorney, and he's looked at it and reviewed it as well.
Okay, I guess I'm confused a little bit about why we have to, what's the necessity of the contract? If we get no information, they just drive out there, if we don't know it, anybody can go.
Yeah,
I don't understand the contract.
It allows it to be free for our staff and students, and it allows the state to pay for that testing with federal dollars. So currently, if our staff members go out there, it's not paid for with federal COVID relief funds. So it's through the same type of billing as if they went to a doctor's office or a hospital. It is also my understanding that currently most of the places that are COVID testing are backed up considerably. So this is going to provide relief to some of our local testing facilities because they're backed up, and sometimes it's taking more than a day to get a test currently.
So then am I correct that this setup is only for the people who they're contracted with? Or can anybody off the street just go?
So somebody off the street could go, but this is to allow for billing to be set up in a different manner. So,
Okay.
yes, you could, as a school board member, you could go and be tested, or a spouse of someone, but they would have to do their insurance and their normal billing, just like if they went into a doctor's office for any other medical service. This
Okay.
just allows our staff, for it to be free and not have to deal with the headache of billing and that sort of thing.
So, any other questions or concerns? I think it's a great idea.
No, yeah, I mean, definitely, I mean, I'm not against it at all. I think it's an excellent idea. I guess I was fighting to be even more exclusive than that. I mean, if it was just for people they had contracted with, I mean, that would be even better. But it does, because I wanted us to do something. You know, if he was at school, I mean, you know, I know in my district, they come once, and they're in my building once a week. They come to the actual building. And the parents can sign a waiver, and they test students, and any of us staff in the building
So,
can be tested. So I mean, at least this is, you know, basically it's almost the same thing. It's just not on campus,
Okay.
and it's a drive-through, so.
yes, but as a reminder too, we also have Danville Pediatrics in our schools, and we have our acute care clinics in our schools. And so we have had a small number of COVID testing through those clinics in our schools.
So they can do it.
Because we can do flu testing and strep testing through our
Okay.
clinics, and and we have done that a small amount. Of course, again, that's optional. That would have been the parent conversation with the Danville pediatric employee that, you know, whether it was the nurse practitioner or one of the pediatricians, and that's a conversation
Right.
and so forth with parents, so it's optional. So this is not excluding that. We have that service
Still.
still and
Okay.
available
Oh, cool.
in our
Well,
schools.
that's good, because
Yeah.
I guess, I mean, I equally do, and I've had concerns, you know, from community members, just of our younger kids who are not able to be vaccinated.
Yes.
And, you know, and they're in the building with adults who are vaccinated but still could be carriers, and they just have no mechanism of defense. And so to be able to say that they can go get tested if they thought they had symptoms, you know, that's good. So, I mean, I'm definitely
Yeah.
for it. I'm glad you guys brought it to the table that, you know, we're doing something. We're putting it out there. So I definitely.
So we have two options in our school district.
That's
Our
awesome.
students have two options, and then this gives our adults an
An
option.
option, okay.
Do we,
Well, I'd like to make a,
do we have to have a motion on this?
We
Yes,
do.
please.
we have to approve the contract, right? So I'd like to offer a motion that the board would approve the contract with gravity diagnostic testing for the Danville Independent School District.
Second?
So we have a motion and second to approve the gravity diagnostic contract as submitted. All those in favor say aye.
Aye.
All those opposed? Motion carries. Okay, the next item, Fidelity Bond. We do have a new finance officer, and along with that, we need to make sure that we have ourselves covered and her covered. So you want to go through this, Dr. McDonald, for a second?
Yeah, this is just a Fidelity Bond. It's just a bond of insurance. Per state law, every school district has to have this Fidelity Bond on the superintendent and the finance officer. And we do have a new finance officer, Kim Huddleston, and this is just the Fidelity Bond of insurance for her. We do this every year, normally at the end of June, so
Which we had.
we did, yes.
Mhm.
And so, and that policy has been canceled.
Right.
And this is the new one that will replace it.
Mm-hmm.
Any questions or
Mm-hmm.
comments? So we need a motion, please.
I'd like to offer a motion that we approve the 2021-22 Fidelity Bond for our new, to cover our new finance officer.
So we have a motion and a second for the approval of the 21-22 Fidelity Bond as submitted. All those in favor of the motion say aye.
Aye.
All those opposed? Motion carries. Okay, up next is Mr. Gopher is going to talk to us about the upgrade for our phone system and probably would like for us to make this an action item.
Yes. Our current phone system is a little over 10 years old. At the end of this fiscal year, June 30th, we no longer have any kind of support or warranty on our system. We had support and warranty, but the system's just too old that somebody doesn't want to support it anymore because you would have to go get components, they're not readily available. So we need to do something. And this has been planned for a long time, so we're asking your approval to purchase a new phone system, which would include all of the internal components that sit at each of our buildings. It would not include phones, but our current phones are compatible with the new system. It would include all new software, interface, and just basically bring our system up to current specs and everything. The total cost is $43,000. It's not a contract, it's just we pay it and then we own the system, and it does give us support for 1 year in warranty, but then we have the option each year to pick up support and warranty, which we would. To give you kind of a financial quick overview, we've currently been paying about $28,800 a year for support and warranties on our old system, and that include purchasing some of the system over time. It was kind of like a buy to or lease to own type of situation. And so we have that amount budgeted for this year. And we also, if you remember, when we signed our new fiber contract, our 5-year fiber contract that started July 1st, we're going to be saving $12,000 a year. And we had that budgeted for this year as well. So our plan is to take the $28,800 that we already had budgeted for the phone system, along with the $12,000 that we're saving that is budgeted for the fiber. And then I've got just a little bit of state technology money that will pay for the rest of it, that goes for infrastructure type things. So it was a planned expense, and so we've planned to spend this, and so we just need your approval because it's a large expense. We're not entering into any kind of a contract, so we're just paying for the system, and then each year we have the option to renew the warranty and support, which would be about $10,000. And that also includes our phone service. I forgot the $28,800 includes our phone service, which is about $450 a month, just to get the service to our system.
One of the things too, the reason we're bringing it to you tonight at a special call meeting is that we were kind of limping along with the system, working towards the plan to get it changed over, and it crashed at Hogsett.
Yeah,
so
I didn't want to tell Mrs. Farmer that. Okay. 2 days before school started, the system.
Which is how we get our records and stuff.
Yeah, and so we're forwarding their fax to central office because their fax doesn't work because it's part of the Hogsett system. But our network engineer was able to engineer a Band-Aid to where the phones would still work. So really the only thing that's not working currently is the fax, but Hogsett is getting their faxes. They've just been forwarded to the central office.
So we're working on a Band-Aid at one of our schools currently. With
we were going to bring it to you the 13th, but when I saw we were having a special called meeting, I already had everything ready, so I'm like, it would be nice if you all could approve so we could get a 2-week jump, getting everything in place. It will probably take anywhere from 30 to 60 days to get everything up and running. And part of that price includes, all the programming, all the training for my staff. And so we'll be able to take a lot of it over from there. But then it's also peace of mind, so if something were to crash or something were to break, we have support, and they'll get back with us same day type of support. So I think that's all.
Over time, and I know that Mr. Gilbert threw out quite a few numbers, but over time, our yearly cost is cheaper. So currently per year we pay
$28,800.
And our new yearly cost will be? After
this year would be 10 something, a little bit over 10. So over time, after year 3, we're already paying less than we've paid the last 10 years, because that's basically been the same figure we've been budgeting and paying 10 years. So yeah, in year 3, we start to save money, and then year 4 and 5, we we save, what, $18,000 a year, so.
Okay.
All right. So it's a win-win.
Yep.
So do we have a motion, please?
Well, you mentioned fax
Oh, sorry.
Uh-huh.
Oh, yeah.
machine. So are we still using fax machine?
Unfortunately, we are. We do, through our copiers, we have the ability to scan to email.
Right.
And I'm just gonna throw out a number, 90% of our communication that has a scan or a fax is scanned to email. But we have doctor's offices and hospitals, they don't like scan for email, so we still have a lot of fax. We still have several records fax from students that come out of state. So we still have a need for a fax. We're not really
There are
paying,
some districts that will only fax us.
yeah.
It's not on our end, it's on the other end of some organizations that's the only way they will get us information or will accept information. Like several medical facilities will only accept through a fax, and I don't know if there's if they're worried about security or what, but it's.
Well, I just mean they can still fax the way they send it. It doesn't hinder how we get it though. I mean, we can get it through.
Yeah, well, we.
I just know we don't use them. I mean, they
yeah.
come, if I receive a fax,
Yeah.
it comes straight.
Well, yeah, right now.
They send it through the old way, but because
It
mine
comes,
has
it
a
does us
number.
that way too.
Okay.
Yeah.
Yes.
We have certain people in each building that get faxes
Yes.
directly to their email, and then they distribute them where they need
Well, I was
to
just
go.
wondering, I mean.
Yeah.
I
Oh,
was-
yeah.
It's
Oh,
just, you
sure
gotta
that
have
we
the
are
infrastructure
keeping up,
there.
I mean.
Absolutely.
You have to have the
We don't
I just don't really ever hear
receive
that
fax.
anymore. I just know that when I get one, I just, it
Mr.
comes straight to
Sanchez.
my
Yeah, it does that with
computer.
us too,
Yeah.
yes.
Mr. Sanfield.
We don't have any physical fax machines.
No.
Oh, okay, gotcha.
I have a physical fax machine in my house now for the last 25 years, and I would not get rid of it.
I know.
Oh, really?
Yes, I will not get rid of it. It
Yeah,
comes
I
with
was-
me.
Austin has a landline.
I was confused on what you were asking, so
Sure
I
do.
apologize, Mr.
That's okay,
Stanfield,
so that's what I
but
was
yeah, we
asking.
don't have any old fashioned.
You don't have the actual machine.
Yeah.
So okay,
No,
that's what
it's
I'm
built in through the copier.
That's what I'm saying, yes.
Yes, yes.
Yeah, I love it.
Okay, any other comments or concerns? Okay, can we have a motion, please?
I make a motion that we acquire the upgraded phone system for the Dallas School District.
So we need-
Second motion.
So we have a motion and a second to approve the new contract for an upgraded phone system as submitted. All those in favor of the motion say aye.
Aye.
All those opposed? The motion carries. Mr. Gover, thanks for working on that.
Yeah, thank you.
I know it's
Congrats
been,
on the new phones.
And Ms. Farmer, be at ease.
No, I'm not worried about it. I knew we get this. But I did know it was problematic.
Yeah, I was trying to keep that from her because she, first getting school started, last thing she needs to worry about is a phone system.
Yeah.
I did catch wind of that though. Somebody said, it was like literally the day before school started, somebody's like,
Yeah.
our phones don't work. And I was like, what?
I would have been like,
thank you, Lord.
that would have been,
Thank you, Lord.
blessing in disguise.
Oh, that's funny.
You know.
Okay, let's go to item number 6 on the agenda, which is a staffing report and possible action. Dr. McDonald?
So it's a staffing request, and so we did, we spent a lot of time talking about additional staff, through the, late last year and through the summer, and we hired a lot of additional staff with our ESSER funds, and that was for intervention and helping catch our students up and so forth. But what we've seen is as we've had a few quarantines and we've had a few of our most medically fragile students that have flipped and had a need to go to virtual since we've seen an increase in cases in the community. And so we're seeing a need in our MSD rooms. So those are the rooms that have our students with the most needs. And so we have 2 rooms that are maxed out. And so you do have a teacher and you have, 1 to 2 aides in those rooms usually. And so if we have a teacher that is working virtually with a student that's quarantined or one of the students that maybe has flipped to virtual, and these are students with very specific needs, so they're needing their specific special education certified teacher, we're needing another set of eyes and help in the room while the teacher is working with a student that maybe is quarantined. So we're asking for 3 instructional assistants to push into those rooms to where we're seeing some quarantines and some students flip to virtual. 2 will be specifically in one of our schools in our rooms that are at capacity. One of them, we have 3 other classrooms, because we have one school with 2 rooms, and we have 3 schools with 1 classroom. The other one that is listed as an instructional assistant, we are going to put them where needed in the other 3 rooms as we see maybe a quarantine, and then a student returns after a quarantine, and then another. And so that one will be placed as needed. So that's a request for 3 instructional assistants specifically to go to the MSD rooms. We're also asking for 1 additional virtual teacher that will be designated for special education students. So we, if you'll remember, designated 3 virtual teachers for our district. We had 1 for 612 because we already had some 612 virtual support in our Anchor Academy. So we at that time we're managing there. And then we asked for 2 elementary virtual teachers. We're asking for a virtual teacher that is specifically targeted to some students with disabilities. And so if a student is quarantined, this teacher is going to help provide the additional services that that student would normally get, whether if it's collab time or if there's pull-out time or something specifically for those students virtually. This person would rotate depending on where we had a need, whether it was quarantine or somebody flipping to virtual. Depending on what our numbers look like virtually in quarantine, there may be a different app later on, but currently we think that this will help us meet the needs of those students. Any questions on that? I'm a little hesitant on deep details there because of privacy with students, but glad to answer any kind of high-level questions around that. I also sent a little bit more, I think, detailed summary in the attachment as well. I have one other ask on here, but I wanted to know if there was any questions about the ask for our special education students. So the second ask is to help with contact tracing. So we do not have a large number, but contact tracing is extremely complicated and difficult. And working with the health department, in verifying, we have a lot of reports of quarantines and or positives, and so we have to do a lot of verification. A lot of time going through seating charts, manifest, if a student was on or off the bus, those sorts of things. And so we did not hire any extra help for contact tracing in the beginning, and it has just really pulled one individual at the central office almost full-time, probably 80% of that person's time where they're not able to get their other tasks done. It's pulling a lot of time from principals, and so we just need some help with contact tracing. So we're asking for, we will hire somebody that we can work with the health department to train, but we were looking at the pay scale of our administrative assistants. So it would be an hourly rate, and we could use them as needed. So we need them probably full-time now. Hopefully that would slack off when we don't have as many quarantines and positives. So we're hopeful it slacks off very soon, but it would be on an as-needed basis.
Any questions, concerns? And this is all paid for through ESSER funds?
Absolutely. Everything paid for with ESSER funds, plus it is all helping us mitigate COVID.
Okay.
We all have to keep evolving, so.
Okay, need a motion, please?
And I offer a motion that we accept the staffing report needs as presented for the district.
Second?
So we have a motion and a second for the approval of the staffing report as submitted. All those in favor of the motion say aye.
Aye.
All those opposed? Motion carries. Okay, item 7, we're going to go into executive session, but we need a motion, please.
I'd like to offer a motion that we go pursuant to KRS 61.810, Section 1F, for discussion that may lead to the appointment of a board member.
Second?
Okay, we have a motion and a second. All those in favor of the motion say aye.
Aye.
All those opposed? Motion carries.
Time
Is
is
it-
6:55 p.m.
Thank you.
Yeah, I have.
You got that? Okay. If anybody needs to take a little break, okay, we need a motion to return to open session.
I'd like to offer a motion at this time that we return to open session.
Second.
So we have a motion and a second. All those in favor of the motion say aye.
Aye.
All those opposed? Motion carries. Okay, tonight we're not going to take action on appointing a board member. We've decided that since Esther did not have a chance to interview these folks, and we all did, that we feel like that we need to give her the opportunity to do an interview with all of us, that we would be present for it. So what we're proposing to do is a Zoom meeting on September the 8th. We would start at 6:30. Dr. McDonald, if I can work with you on getting interview time set up with the three for that evening. And then Brian, work with you also. I just want to make sure that if they're waiting to get in, that they would not have access to the meeting while we're interviewing someone else, correct?
Correct.
Okay. All right, so is everybody good with that?
Yes.
Yep.
Yes.
Because that's what we had talked about. So the goal is September the 8th, we would start the Zoom meeting at 6:30. And then we'll set up the appointment times. I'm going to try to do 15-minute segments,
Yeah, yeah,
which
no, that
with
should
the
be
three,
sufficient.
it will make sense.
Yeah,
Be a lot easier than it was with the six. And then hopefully that night we'll meet in executive session and then again. And oh, that's what I need to ask. Zoom wouldn't even be on, correct, while we're doing the interviews?
Yeah, so we've,
That's right.
yes, that you cannot be, yes. And we were under, I think that you need to check with Vince on the situation with the Zoom meeting, because we were under, from the Attorney General's office a ruling that we could do the Zooms. And I just haven't checked lately to see what that had went away at one point. So you probably just need to check with Vince to make sure all the legalities around being able to do a Zoom currently. I think it's fine, but I just advise that you check
Okay,
with the
Maybe we can't
attorney.
take action on Zoom. Maybe we can do the interviews, but we'd have to actually convene
Yeah.
publicly to do a.
Yeah, in person,
vote.
yeah, right, publicly in person, yeah.
Well, and I will check with Vince tomorrow.
okay.
I'll send him an email tonight.
Okay, so that's potential.
And that's potential. And I guess also the possibility if we had to meet in
It's just
person,
same date and time.
we'll just go with that.
I'll just.
Well, then let me just ask
Go ahead
this.
without me.
Do we just want to go on and just forget the Zoom and just go on and meet in person?
You can,
And-
I won't be present, but you can do that.
Okay.
But you can,
But I've already interviewed them, so that's not an issue.
okay.
So what do y'all prefer?
That's fine with me.
You sure it's okay with you?
Absolutely.
Okay, so let's change train cars. And we're going to do a meeting September the 8th, 6:30.
Here,
At Central Office. There'll be the three of us, and I know if Wade can work it out, he will, so,
Absolutely.
that'll just keep it clean,
Yeah,
easy to do, we don't have to worry about the Zoom part of it. And then we'll set up the appointments, I'll get with Dr. McDonald on the times, and make sure everybody has that.
Okay.
Okay, is that an agreement?
yes.
Okay. So, I don't think we need to vote on that, I think it's just a procedure.
Yeah, all right.
All right, so we do need to do item number 10, which be adjournment of this special
I'd
call
like to
meeting.
offer a motion of the meeting, the special call meeting, to adjourn.
Second,
So we have a motion and a second. All those in favor of the motion to adjourn this meeting, say aye.
aye.
All those opposed?
Then
Motion
okay.
carries. Thank you all.